There are many different ways to control asthma. It's important to recognize that asthma can be a life-threatening illness, but it doesn't have to be. Almost everybody's asthma can be very well controlled in a way that doesn't actually impair your life at all. So let's talk about the different ways to control asthma. Well, the hallmark of asthma treatment is medication. There are two types of medication. There's fast-acting or relief medications. Those are also known as rescue medications. They have an obvious benefit in an asthma attack. And there are longer-term controllers that make it less likely for you to have an asthma attack to begin with. Those two categories of medications are the bulk of asthma treatment. But there are other treatments for asthma as well. Technology has helped in treating asthma enormously. And one of the clearest examples of this is the ways that we get medication to the spot that's needed in an asthma attack. There are now delivery devices that weren't available 20 or 30 years ago that very much help people control their asthma in a way that can be invisible. Spacers, nebulizers, inhalers. These are devices that actually deliver the medicine through the lungs into the respiratory system, right to the source of the problem, and treat the problem at the site. This allows us to use much less medicine than what people needed to use 20 or 30 years ago. Now, there are other treatments besides that. There are devices that help us know how much medicine to use. These are called monitoring devices. Monitoring devices help us titrate the amount of medicine. Are we using enough medicine at the right place? Are we using too much medicine? These can be peak flow meters. They can be more complicated than peak flow meters. Some are physician used, some are to use at home. They help us know what's the right amount of medicine to get you under control. There are also allergy shots. Allergy shots can control people's asthma if allergies are your main trigger. Imagine a 5-year-old with asthma every spring. If that 5-year-old also has symptoms of hay fever, itchy, red eyes, runny nose constantly, but only during the spring, that 5-year-old very likely is suffering from allergies. It's not uncommon for a 5-year-old like that to be on many allergy medicines. When it's severe, and when we can identify what those allergen triggers are, that 5-year-old could benefit from allergy shots. And treating the allergies with the allergy shots may, in fact, treat the asthma. The allergy shots is a technology that actually may allow us to get by on very little asthma medication because we're recognizing the source of the problem and treating it. So we're treating the asthma at the source, not downstream.